Good evening, everyone. Myself, Arshdeep Singh, Assistant Professor, Mira Medical Institute of Nursing and Hospital of Bohur. Today, I am going to explain you about the next two health programs, national health programs. So, in the previous lecture, I have already explained you about the National Mental Health Program and the National Rural Health Mission. Okay, so in today's short lecture, I will explain you about the National Blindness Control Program. Okay, so that is a very important program. So all of these national health programs are very important as the theoretical point of view as well as the practical point of view, and the examiner in each practical or the viva asks you about the different questions related to these type of national health programs. So I have chosen this topic as the uh, today's lectures. So I'm going to start with the topic, today's topic, that is National Blindness Control Program. That is the first topic for the today's lecture. So first of all is the brief introduction about this topic. So the program was launched in 1976. So all of these programs are, or mostly these programs are launched in the 70s or the 80s. So this program was started in the year 1976. So as the name indicates, this program was for the prevention of the blindness or the diseases that are related with the eyesight disorders or the blindness problem in India. Okay, so first of all, the government of India launched national health program for the control of blindness and to check blindness due to preventable causes. So this was about the introduction. That first point included the that the government of India launched a national blindness control program in 1976 so as to control the various types of diseases that are preventable or the various causes that are preventable but are creating the blindness in the community people at the national level. Okay, so that was the main goal. We can say that was the main objective. Its purpose was to prevent the blindness throughout the India. Second, three important leading causes of the blindness are covered under National Health Program or the National Control Program. So under this program, the government of India has included three of the disorders that are included under the umbrella term of the National Blindness Control Program, so that we can prevent these diseases, so that we can be able to prevent the various types of uh, causes that may lead to the blindness at the national level. Okay, so uh, these causes were, first of all, was the cataract. Cataract is a disease. Okay, so eyesight disorder, we can say that, okay, mostly found in the people of the older ages. Okay, so blurring of the vision is the main sign of this disease. And second one is the vitamin A deficiency, for which we are providing the vitamin A doses the children below the 6 years of age. Okay, or more than 6 years of age. So and at the age of the 5 years, so the we are providing the children with the 10 of the minimum doses of the vitamin A, that include the 1 lakh international units and 2 lakh international units. Okay, so that is because vitamin deficiency is directly related with the eyesight. So it may lead to the various types of disorders. So in this we have included the vitamin A deficiency disorder under this term. And last one is the trachoma. That is also a disease that is under the we can say that that can lead to the blindness. So that is the third disease that is to be covered under the National Blindness Control Program. Okay, so that was about the brief introduction about this program. Second one, is about the goals. So what were the various goals of this program? So first of all, there were different goals. First of all was to reduce the blindness, uh, to reduce blindness from the country from 1.4% to 0.23% by the year 2080. Okay, so that was the first goal, that the then existing cases in the country The first objective was to reduce the percentage, somewhat percentage of the cases, that is from 1.4% to 0.23%. So we can say that in near about 24 years, the goal was to decrease the number of cases, total number of cases, about this much percentage. Okay, by the year 2080. Second, to provide comprehensive eye care through PSC. PSC is, that is primary health care. So under the PSCs, under the term of the PSC, the government of India tried to provide the services that will also include the services related to the eye disorders. Okay, so that was the second goal. Next are the objectives, various objectives. So first was to reduce backlog of the blindness through identification. So the missed cases or the cases that are not able to report, or the goal was to identify these cases and to provide the proper treatment. And second, to develop comprehensive eye care facilities in every district. Okay, so wise, we were covering the national tuberculosis disease under the National Tuberculosis Control Program or the cancer program at the district level. In this program also, we were providing, or the government ensured to provide the services at the district level, so that we can be able to provide the services and in an effective manner and we would be able to cover the each district and the cities and the rural areas that are to be covered under the districts. Okay, so to increase the effectiveness of this program was also launched at the district level. Next, to develop human resources to providing eye care services. Okay, so uh, to develop human resources to providing eye care services, so we are having less facilities related to the providers of the services related to the eye disorders. So the one of the goal or the objective was to create more resources so that the community people should get more of the services from these resources, and there should be the prevention of the various types of disorders that are relating with the eye, so that we can be able to prevent the cases of the blindness. Okay. Next, to improve the quality of the services delivery. Okay, so how would we able to provide the quality services? First of all, we should be having the more of the resources. We are lacking in the resources, so we would not be able to provide the effective services. So to increase the quality, firstly, we must ensure that we are having the proper resources. Then we should be having that include the manpower and the facilities or the equipments, doctors or the nurses that will be included under the manpower. So we will be only we can provide the services or good quality services if we are having the manpower and the other resources. So that was also an objective. Okay. Next, to secure participation of the voluntary organizations, participation for the participation in private eye care. Okay. So that is also a very good point, because the voluntary health agencies of India or at the international level, they are providing the services or helping the government, Indian government, from time to time, the providence of the services related to the various types of disorders or the infections or the diseases at the national level. So one of the organization is All India Blind Relief Association, that is one of the voluntary health organization of India. Okay, so uh, uh, we can also say that these are the agencies from the uh, of the Indian origin. But if we talk about the international level, there are many agencies that can also help, or that are helping the Indian government in the providence of the services related to eye or the eye related disorders. Okay, so in this objective, uh, the main objective was to secure the participation, because with the participation of the voluntary health organizations, we would be able to cover more of the people that can be at the risk of having the uh, disorders related to the eye or relating with the blindness. Okay, and last one, to enhance community awareness on eye care. Eye care is or the eye disorders are a major health problem. We can say that mostly in the East people, it is a major issue. So all the people in the community must be aware of the eyesight disorders and the various types of infections and diseases that are relating with the we can say that the eye. So there is need to aware the community or the motivate the people so that they could manage their eye care so that they could prevent themselves from the various types of infection and diseases, and in the end, they can prevent themselves from the risk of the blindness. Okay, so these were the major objectives we can say. Okay, next is Next is I would talk about the activities. Okay, so what were the major activities that are included in this program? So a massive dose of vitamin A is given every 6 months to children between the age of 6 months to 5 years. Okay, so that is a activity that is done under this program. That uh, under the 5 years of children, the children who are under 5 years of age, each child was to provide with the dose of the vitamin A at the interval of 6 months, so that if a person or the child at the age of 5 years would be able to get the 10 of the doses of the vitamin A, so that we can prevent the deficiency of the vitamin A in the children, and we can be able to prevent them from the risk of the blindness. Okay. Second, the scheme gives priority to the children aged between 6 months to 3 years at uh, the highest prevalence of the clinical sign of vitamin A deficiency are repeated in this age group. Okay, so the first priority is given to the children between the age of 6 months to 3 years. Okay, so that is the activity, and the dose. Next, I would explain you about the dose. What is the dose that is provided to these children? So first point is 6 to 11 month old, one dose of the 1 lakh international unit, and that is one of the question of the Viva related question that could be asked in the external exam, that could be asked by the external examiner during the final practical examination. Okay, so he or she can ask you about that. What are the level of the doses, or the what dose is provided to the children between the age of the 6 months to the 5 years of age, and so that is the pattern, that is 6 month to 11-month old, one dose of 1 lakh international units, and second is 1 to 5 years of old age children would receive a dosage of 2 lakh international unit of vitamin A every 6 months. Okay, and third point is, like as I have already explained, that a child is expected to receive a total of the 10 doses of vitamin A before his fifth birthday. Okay, so before the child gets 5 year old, so he or she must be uh, must have taken the 10 of the doses of vitamin A, so that they could be prevented for the deficiency of the vitamin A in their body. Okay, so that was a short term, we can say that the measure that we are doing under this program. Okay, but if we talk about the long term strategy, so how can we prevent the vitamin deficiency for the long terms? So that will include the improvement of the dietary intake. If we can modify our diet, that would be that is enriched with the vitamin A. So we don't need any type of the dosage, or the any type of, we can say, the medicine, the drug related to the vitamin A. So if our diet is enriched in the vitamin A, so we can't be having any type of deficiency relating to the you can say that the vitamin A. Okay, so the improvement of the dietary intake of vitamin A through regular consumption of vitamin A rich food such as dark green leafy vegetables, yellow vegetables and fruits, dairy products, and promotions of the breastfeeding. So these are some of the long-term strategies that we can use. Okay, vitamin A rich food such as dark green leafy vegetables that are enriched in vitamin A, and yellow vegetables and fruits and dairy products, and promotion of the breast milk, breastfeeding. Okay, that would, or that can prevent the risk of the vitamin deficiency, and that can prevent the person, any person, from the risk of the blindness. Okay, so that was about the dosage and the long-term measures. So that was all about the program of the National Blindness Control Program. Okay, so next topic for the today's lecture is National Water Supply and Sanitation Program. Uh, so I want to explain that that is a very big issue. That the proper water supply and sanitation in India is a major issue. We after the 70 years of independence, we are still not getting the proper water supply. We can say that we are not provided with the wholesome, safe water, or the sanitation problem. Uh, so the status of the sanitation in India is very poor. Okay, so government is trying day by day by different types of program and by performing various activities so that they can provide us with the proper water supply and the sanitation program could be solved. But till date, we are not getting any solution related to this problem. Okay, so Indian government has had already launched a program related to the National Water Supply and Sanitation Program. One thing I want to add with this thing is that the I have made a lecture on the uh, 5-year plan. So in each 5-year plan, that uh, this point was a major objective that the providence of the wholesome safe water, of the water supply and the sanitation program, starting from the first 5-year plan to the 12 or the 13th 5-year plan. That was a major objective in near about 12 to 13 5-year plans. So in the 70 years, uh, uh, not a single government was able to provide us with the or can achieve this type of objective. Okay, so let's talk about this program, that is National Water Supply and Sanitation. First of all, is some of what related to the introduction. Drinking water and sanitation facilities are very important and crucial for achieving the goal, of health for all. So if we are able to achieve this goal, we can be able to prevent the uh, general population from the various types of disorders that are, you can say that the waterborne diseases or fecal or the disorders that can transmit through the fecal oral route. So there is a list of the diseases that are spread out or transmitted from these type of, you can say that the causes or due to the non-supply of the wholesome safe water or the due to the sanitation problem. So that acts as a barrier for the uh, achievement of the goal of health for all. That is our objective for the National Health Policy 1983 and 2002. So to remove this barrier, Indian government launched a national health program, that is National Water Supply and Sanitation Program. The next, safe drinking water supply and basic sanitation are so intrinsically linked to human and ecosystem that they, along with proper hygiene, form the most essential components of a safe and healthy life. So, if we want a safe and healthy life, the basic need is the safe water supply. Okay, if we can say that the water is the basic need, that is also true, and it is a reality. Without proper water, uh, safe water, we can we can't even survive. Okay, that is our basic need, but not a single government is able to provide us with these type of uh, services. Okay. Next, approximately 80 to 90% of the untreated sewage is discharged directly into rivers and streams, the main source of water supply in cities, and human feces remains one of the most dangerous pollutants, spreading microbes that cause typhoid, cholera, diarrheal illness, amoebic dysentery, and other virulent diseases. So I have already explained that uh, uh, that a major issue in India is the waterborne diseases. So that is also written here that typhoid, cholera, diarrheal illness, or any other type of disease, a list of diseases is there that are affecting the human population in India, just because 80 to 90% of the untreated sewage or the we can say that the human waste is directly poured into the rivers or the streams that are a major source of the pure water or the safe water. Okay, so if we are saying that humans are responsible for the polluting the safe water, or if today we are not getting the safe water supply, we ourselves are responsible for this. Okay, but government has to do the various initiatives. They have to take various initiatives and the program, and they should be having some policy that how this thing can be stopped or banned. Okay, so very little is done related to the this issue. Okay, so that was about the introduction. Next, the Union Government of India appointed the Environmental Hygiene Committee, which recommended a comprehensive plan for providing safe water supply and sanitation to the population. And thereafter, the National Water Supply and Sanitation Program was launched in 1954. Okay, so in the year 1948-49, the committee or the commission was set up by the Indian government. So that has to submit a report related to the or that uh, was informed to make a plan related to a comprehensive plan for the at how we can provide the safe water supply and sanitation services to the uh, to the people at the national level. Okay, and on their recommendation, and we can say that on their research, a national water supply and sanitation program was launched in the year 1954. Okay, and then the United Nations declared 1981 to 1990 as the International Drinking Water Supply and Sanitation Decade. So that is the information here, written here. The following targets were fixed by the Indian government for the decade. So uh, uh, we can say that our strategy or the policy was made by the United Nations. Okay, uh, for 10 years that they were doing something, or they were taking various initiatives in these 10 years. Okay, so they could be able to supply the proper water supply and sanitation. Okay, services. So what were these? First included the 100% urban and rural water supply. That was a major objective that was to be attained at the national level. Second, 50% urban sanitation and 25% rural. We can say, okay, 100% urban and rural water supply and 50% urban sanitation. So that was a very important thing, and that was to be achieved in 10 years. Okay. Next, the guinea worm eradication program was linked up with this decade. Okay, so next thing, they added the guinea worm eradication program that is also disease with this. Okay, and in the year 1986, the National Drinking Water Mission, also known as Rajiv Gandhi Drinking Water Mission, was launched in order to provide scientific and cost-effective content to centrally sponsored accelerated rural water supply program. So in these years, a new program that was named as Rajiv Gandhi Drinking Water Mission was again launched, so that with the same objective, just to provide the pure water supply and the sanitation services. Okay, next. In the year 1990, the United Nations General Assembly accepted the following guidelines given in the New Delhi Declaration for Water Supply and Sanitation. Okay, so at the end of the decade, some of the guidelines were given by the United Nations. What are these? Protection of the environment and safeguard of the health through the integrated management of water resources and solid waste. Okay, so if we are going to provide, or we have to provide a safe water supply, so we must do something for the sanitation, because I have already explained that uh, almost 80 to 90% of the sewage is disposed of in the, I can say that 80 to 90% of the sewage is disposed of in the uh, uh, resources that supply the pure water. Okay, so firstly, the first thing is to manage this issue. Okay, second, organizational reforms, changing attitudes and behavior, and full participation of the women. So there is also need of the new policies, and we have to change the attitude of the people, so that they should be dedicated to we can say that we have to inform the population at the national level, so that the general population or the general public must ensure that they should not pollute any of the water resources by their own. Okay, so they should avoid polluting the various types of rivers, canals, and all the things that are the resources of the safe water supply. Next, community management of the services and strengthen the local institute. So we have to strengthen the institute that would work for the we can say that the providers of the water supply and sanitation, and sound financial practices and application of the appropriate technology. So major rivers of India like the Ganga and the Yamuna, they are also polluted. So government should do various things, that they should raise the funds and provide the extra funds for the cleaning of the these rivers, cleaning of these rivers. So with the appropriate technology, so that we might uh, we might get we can say that services related to this issue. Okay. Next is the rural sanitation program. So there are two programs I would explain you about that. That one is the rural sanitation program, and second one is the urban. So as the name indicates, for we are dividing the regions, like the rural sanitation program for the rural areas and the urban sanitation program for the urban areas. So first of all is the rural sanitation program. What is this? Under this program, following activities were considered, that is demand-driven low-cost sanitation approach. What we can do is to provide the cost-effective methods of treating the issue of the sanitation. Okay, so we have to use a strategy that might not include a lot of money to be consumed so as to get rid of this issue of the maintenance of the sanitation. Okay. Second, involvement of the private bodies like the NGOs to provide sanitation facilities. So, NGOs are a very important part in providing of the services, and they help and support the government in providing of the services. So, we also need the NGOs, that is non-governmental organizations, in this issue also, because they are having the manpower and the funds at the time, at the point where the government is not able to provide the services related to this issue, these NGOs would help us to get rid of this issue. Okay. Next, interesting panchayati raj institutions and local administration, the responsibility of operating and maintenance of the water supply and sanitation, not just at the major levels, but at the panchayat level, Zilla Parishad level, okay, and the Gram Panchayat level. So we have to manage this issue of the water supply and sanitation. All the subpoints and the DCs, deputy commissioners, and the MPs, MLAs. So at the ground zero level, we have to do this thing that each subpunch, for example, each subpunch of the area should educate their people that they should not pollute any of the resource related to the water stream, or they should manage the sanitation. Okay. Next, achieving zero incidence of the guinea worm disease by 1993 and total eradication by 1995 and improving water quality. So that was the objective under this, that the guinea worm has to be eradicated and till 1995. That was the objective. And next is improving sanitation in rural areas through IEC program. As I had already explained, IEC is information education and communication program, and introducing the concept of physical environmental sanitation. That would include the sanitation at the rural as well as the urban levels. Okay. And next, converting all existing dry latrines to low-cost sanitary latrines. That is the objective that is dealing with the sanitation. To ban the open defecation or to ban the borehole latrines, and to provide the low-cost sanitary latrines so that the waste or the human waste should be disposed of in a proper manner. So that was about the rural sanitation program. Next is about urban sanitation program. So as the name indicates, that is for the urban areas. Under this program, the following activities were considered. First, providing reasonable level of sanitation facility to a large population. Okay, so, as we already know, the 30% of India's population is residing in the urban areas, but there is still a issue of the water supply and sanitation. So, first point is reasonable level of sanitation is to be provided at a large population. Second, total elimination of dry latrines and manure scavenging. What is manure scavenging is the cleaning of the sewage, like we can say that that are built on the road, under the road, okay, in which the human disposal or other sewage content is collected. So the some of the workers they get into that sewage hole, and they manually clean that specific we can say that the chamber. Okay, so that should be avoided or banned, because it may lead to the various types of disorders or infections to that specific person who is cleaning or manually cleansing that chamber. Okay, so new techniques should be ensured or initiated to prevent these things. Okay, now this is changing. This thing is changing. Now we are having machines. None of the person has to get into the chamber and clean it, that specific chamber. Okay, we are having machines that are the automatic machine, and we are cleaning these type of chamber or removing the sewage uh, by use of these machines. Okay. Next is low cost on-site sanitation, unsewered parts of the cities, and small and medium towns. So, according to this objective, each and every point or every area should be covered. Okay, or there should be the sewage system in each area. Next, technological innovations to improve the reusability of the recycled waste. So, the waste that is to be recycled. Okay, so we have to initiate or find we have to find the new innovative techniques so that we can recycle that waste for any type of useful purpose. Next, polluter paying principle should be applied to the finance waste disposal programs. A polluter paying means to say we can apply the or implement the punishments in the form of cash or imprisonment or something like that, uh, so that the major factories of the milk, they should be banned from polluting the major sources of the water. Okay. Next, involvement of the NGOs, private sector, and community, as I have already explained, converting all the existing dry latrines to low-cost facilities. That is the same objective as in the rural sanitation program. And last one is the recycling the treated effluents for horticulture, irrigation, water harvesting, and transport system for solid waste disposal. Okay, so if so that is the point relating with the recycled human waste. Okay, so if by treating the human disposal or any type of the waste, we can use it for the horticulture, irrigation, and water harvesting. So these are the techniques by which we can use the or dispose of properly dispose of the human or the other type of disposal, and we can prevent these types of major sources like the streams and the rivers from polluting from pollution. Okay, so that is about the main activities that have to be done in the urban sanitation program. Okay, so that was a program. That was all about the program of the National Water Supply and Sanitation Program. Its main objective was to prevent the people from the various types of water-borne diseases. And second thing is to provide uh, the proper water supply uh, to ban the open defecation. Okay, so that's the major issue, and to manage the sanitation at the national level. Okay, so that was all about the today's topic. So today I have explained you about the National Blindness Control Program, and second one was National Water Supply and Sanitation Program. Okay, so that was all about today's topic, and in the next week I will explain you about a new topic. So just stay with us and get connected with us, and me and my team members would inform you that uh, we will explain you about the different type of topics on different days, and you will get a notification. So for that, you should subscribe our channel at the YouTube page. So I am doing this live session today. I'm doing this live session on the our college official YouTube page, that is Media Nursing College. So you must subscribe this channel so that you will get up-to-date notifications. Okay. So thank you everyone. In the next week, I will meet you with a new topic.